Let's bow our heads. Dear Lord, we just want to thank you, our Heavenly Father, for the opportunity to gather together and see what helps our brains work. You've been amazing to create our brains. We don't even know a lot about it, but we do know some things about it. We ask you today to open our hearts as we listen to Dr. Nedley speak and inform us of some of the wonderful things that are right around us that we can use to help us to think properly. Guide our minds, open our hearts to be receptive. We pray in Jesus' name. Amen.
Good morning. Good to be with you again this morning. Had a nice walk with Don and Diane. I don't know if they're back yet. Are Don and Diane here yet? We met up with them on the Thumb Butte Trail, and they showed us the way to get there this morning in the cool of the air. And we had to turn back because we had to be here for the meeting, but they might have gotten lost because it was their desire to come back in time for the meeting as well. But it is some beautiful hiking trails around here, and we're getting more acquainted with the area. Well, this area of nutrition in the brain is an important one. As we kind of mentioned last night, there is no lifestyle factor that is not a choice. Everything that we do, lifestyle-wise, is a choice, despite some of the deceptions that people might say out there. Now, you might say, well, I'm an alcoholic, so that's not really a choice because I'm addicted. Well, I understand the addiction aspect of things, but yet you can choose and you can be part of a process, whether it's AA or whether it's another program like ours, to actually go a different pathway and to choose lifestyle habits that would be better. We did a study a couple of years ago. In fact, if you look in the scientific literature, you'll see our name in a lot of different peer-reviewed publications. But this was an internal study in regards to the community-based program, and it was just mentioned that I think Charles here is associated with the community-based program here in Prescott, Arizona. And we were kind of interested in before and after results. What things change? And we have noticed that a lot of things actually do change in a positive way in many different lifestyle factors, from exercise to sexual factors to a number of factors. Alcohol consumption changes significantly. Tobacco, a lot of addictions are being given up in the 8-week program. In fact, we have found out that through our studies that the 8-week program is actually more successful than a stop smoking program in getting rid of tobacco, even though it's not a stop smoking program. The reason is we're helping the brain chemistry part of things so that it's easier to give up these difficult to give up lifestyle habits. But the area that kind of surprised us when we did this study is the most significant changes the average person makes, where they're more likely to make a change in this area than in any other area, is the area of nutrition. And so nutrition is powerfully important, and the vast majority of people that just get educated in the area of nutrition are going to make some significant positive changes. And so this area of nutrition in the brain is, of course, important in today's world. If we see here on the screen, this is the synapse. This is where communication occurs in the brain. There's an electrical transmission coming down, releasing that neurochemical. We might call it serotonin. And if the receptor nerve has serotonin receptors, as a result of that serotonin hitting the receptors, another electrical transmission will occur. We call that synaptic activity. And this is the area that every pharmaceutical company in the world is trying to affect, are these areas of communication in the brain. Now let me ask you a question. Do these pharmaceutical agents help us to make more serotonin, for instance? No. And do they help the receptor nerve to get more serotonin receptors? No. So why is it then that the doctor says, you need to take this for your serotonin levels? What is it actually doing? It's actually not helping us make more serotonin. It's not helping our receptors. But not seen there is on that diagram among the transmitting neuron are what we call, or I call in a lay sense, vacuum cleaners. These vacuum cleaners actually are there so that when that electrical transmission occurs, the serotonin that's in that synaptic area gets vacuumed back up into the neuron. Now, why is that important? Because it can be saved and it can be utilized again. It makes the brain a very efficient process. So those vacuum cleaners are important to be able to help the neuron to have more serotonin, so when there's more communication needed, it can release some more. But how the drugs work is they actually plug up the vacuum cleaners on those transmitting neurons. Now, when they plug up the vacuum cleaners, how is that helping the serotonin activity? Well, it actually is to some extent, because sometimes the vacuum cleaning occurs before there is synaptic activity if you're short in serotonin, and so it allows more serotonin in that synaptic cleft to hopefully produce that electrical transmission. And so what do we call these vacuum cleaner pluggers? The nice pharmaceutical name, they're called selective serotonin reuptake inhibitors. And so it's the reuptake area. That's where that term SSRI comes from. It's actually plugging up the reuptake of the serotonin channels, these vacuum cleaners, and that produces some short-term benefit over the course of months, but over the course of many months, it actually is going to deplete the neuron of the very substance you're trying to treat, because you start running out of serotonin. Serotonin was low to begin with, and now when you don't have it being saved and being uptake every time, you end up with a shortage, and that's why you need higher doses, that's why you need more medicine, and that's when individuals become psychiatric cripples, where they have to see their doctor very frequently and get their medication adjusted, and by the time they get to us, they still have severe depression, and they're on 4 different medicines, one trying to block the serotonin reuptake channels, another one trying to block the norepinephrine uptake channels, and so we have all of these neurochemicals that they're working on trying to block up these receptors, but we aren't really taking care of the primary problem that caused the shortage to begin with. And so this is why nutrition is very powerful for us in being able to work on the primary problem. Let's take a look at some of the most common nutrition hits, or actually what nutrition hits can do in general. It's possibly the most overlooked cause of diminished mental power, can have profound effects, and once a nutrition change is adopted, it takes 7 to 10 days to begin noticing a difference. Now, there are certain instances where we might see a difference in 3 days. If we have time, we'll get to that. There's certain types of nutritional issues where we'll see a dramatic improvement within 3 days. But most of the time, it's about 7 to 10 days. That's one of the reasons why our program is a 10-day program, so that they can already start experiencing the benefits of these changes before they leave. Gradual improvement, however, continues beyond that 7 to 10 days, and it actually peaks somewhere at 3 to 6 months afterwards. And so these nutritional changes will continue to produce very positive effects and continue to ramp up these positive effects over the course of 5 or 6 months. So clues of a nutrition hit that we look for in our dietary inventory. If the dietary inventory indicates a lot of junk food or meat, that could be an issue. Signs of a carbohydrate addict. Many people with depression and anxiety are sugar addicts or carbohydrate addicts. Why is that the case? Because sugar temporarily increases brain serotonin levels, actually helping the person to feel better. It not only tastes good, but they feel a little less depressed afterwards. And then there can be other clues that we see in the blood work, such as low B12 or folate levels. And of course, we're checking a lot of things in the blood work. By the time they've come to us, they realize this is their last stop. In fact, many of them will tell us, if this doesn't work, I have no hope from this point forward. We've gotten all sorts of threats. You might imagine some of the extreme threats we've gotten if this doesn't work from many individuals that have hopelessness and those type of thoughts. But fortunately, the program does work because our brains are more similar than they're different. And when we utilize these approaches, these brains get remarkably better. And so we have to look at, have no stone being left unturned. If someone has a B12 shortage, we want to know that because that'll be a powerful influence on them. If they have a folate deficiency, or if they're undermethylating or overmethylating or having some other epigenetic issue going on, we can pinpoint that and be able to produce a dramatic response as a result of fixing that defect. But often no obvious clues are present. One of the reasons why is because we have found out that people answer dietary inventories not always in an honest, transparent manner. They tend to maybe put down what they think they should be eating instead of what they are eating, or they have a tendency to forget exactly what their diet is like. And so these dietary inventories, because they're based on the history of the time, are not always completely accurate. And then another reason why they're not completely accurate as well is because many individuals come to the program thinking nutrition is not their problem. And I'll say, why do you know nutrition's not your problem? Because Uncle Bob has a worse diet than I have, and he has no depression. So it can't be my diet. Well, what's the fallacy behind that argument? Uncle Bob, that might be his only hit. And we haven't gone into this, but normally there's 4 different categories of causes before depression comes about, or anxiety. And so this individual might have 3 causes, and the 4th is nutrition. So if we fix the nutritional cause, it can have a very dramatic response. And so they tend to minimize the effects of their diet often. And another reason why they tend to minimize it is that many of them have been to psychiatric institutions. They've seen psychiatrists their whole life. And they'll say, "You're the first doctor that actually asked me about what I'm eating." In other words, they're saying, if this were so important, the psychiatric world would have been talking to me about this before. And so, it sounds like you may be a little bit of a quack even going into this area, because nutrition can't be that important, otherwise my psychiatrist would talk about it. And we'll talk about that. When we first started this program in 2002, the evidence was overwhelming that nutrition had a dramatic role to play. But now the evidence is not just overwhelming, it is overwhelming and conclusive to the point where we'll show some slides at the end as to where we're at with this today. And so any psychiatrist or mental health professional that does not address the area of nutrition, according to the experts today, it's akin to committing malpractice, because they're totally ignoring a most powerful area that can produce a dramatic response in the patient. And so this is fortunately why I'm called around the country to give continuing medical education courses to physicians as well. So that physicians can get a toolbox expanded beyond just 150 psychiatric medicines in their toolbox, and which one to choose and at what dose and what combination, which is the typical exclusive toolbox of the typical MD, a mental health professional. But let's talk about the nutrition hits. One of the most common is not enough tryptophan, particularly in the brain, which of course we have to get this from the diet, but once it gets into the system, it needs to go into the brain. Tryptophan is important because this is what we make serotonin from. It's also what we make melatonin from at night. And so we need this in order to have rejuvenating sleep. It also is where we get niacin from, or vitamin B3. The problem with it is it's the least abundant amino acid in the diet. And the conversion of tryptophan to 5-HTP, which is needed to make serotonin, is inhibited when you're stressed out and not handling stress. It's also inhibited with insulin resistance. What's another term for insulin resistance? Diabetes. Or you can have insulin resistance without diabetes. What is that called? It's called metabolic syndrome, or prediabetes. And so there's a host of Americans that have metabolic syndrome and prediabetes. They have insulin resistance, and that means they're going to have trouble converting tryptophan over into serotonin. So we have to help that insulin resistance. I am one, for instance. The insulin resistance is something that's in the gene. It's a genetic mutation. And I actually have that genetic mutation because I come from a history on both sides of my family of diabetes. And so one of the ways of taking care of insulin resistance is what? Nutrition is a good way of doing it, but it's not just nutrition alone. It's exercise, and it's one of the reasons why I exercised 5 miles this morning before I got here. A diabetic needs insulin every day, and a pre-diabetic needs to have insulin sensitivity every day. And so I'm very faithful in regards to my exercise program because I don't want to have my own brain chemistry affected by this. And of course, there's dietary things as well that are important. And amazingly, even though you have the gene from both sides of your family, that gene is totally inactive when we are on the right lifestyle program. And so it's like the gene doesn't even exist in regards to the complications and those sorts of things. And this is what we can do with lifestyle factors, even with some bad genes. So also another issue would be if you have a magnesium deficiency. This is why magnesium is important. We measure this in everyone coming to our program. Vitamin B6 deficiency is also something that will bring this about. Lack of light. This is why the light therapy is something that's very important for us to be able to get enough serotonin and also reset the body clock. And also, the older we get, the harder it is to produce serotonin. This is why depression used to be, 100 years ago, just a disease, almost exclusively a disease of the aged. The older you got, the more likely you were to have depression, and even then it wasn't all that common. But interestingly, even though you might be 100, you can still make adequate serotonin if you have those other factors working well. By the way, just Saturday, we arrived here on Sunday, but in Sabbath I was in Weimar Institute, and we had a gentleman who was a retired pastor. And by the way, I haven't seen the data on this, but I will quote it because it came from a reliable source. Our New Start chaplain, who's been very effective, at Weimar Institute, we're a very small institute there, a small health center, but we have over 100 baptisms a year from our health programs. And part of that is the work of the counselor and the chaplain that's there. But our New Start chaplain took a job of pastoring a large church in Houston, in part due to family they're connected with Houston and his need to be more connected with the family that's there. And his first workers meeting was just last week, and he went to the workers meeting of the Texas Conference, and their data was presented, of course, regarding the blue zones. You're aware of the blue zones. What is the longest living group of people on planet Earth? It's actually Seventh-day Adventists. And it's, of course, the lifestyle that is associated with that. But in the Texas Conference, what they presented data was that is true only of the lay membership. The pastors live 15 years less than the average lay member. And of course, the pastors tend not to exercise. They have meetings where they're just having to sit down. They're at board meetings and a lot of sit-down activity there. And pastors are not the ones that are known to be endorsing the health message all that much often. And so they don't necessarily live that lifestyle, and it turns out they're not a blue zone person unless they're living like the average lay membership of the Adventist Church. So when Damon Sneed showed up, that was our New Start chaplain, and they introduced him as coming from Weimar, he says he got swarmed by all these obese pastors in the Texas conference saying, what can I do about this? You're from Weimar. I know you know how to help me with these conditions. And so they're actually going to have a whole workers meeting just with Damon Sneed talking to them from the Weimar background of things. But there are some exceptions to the rule. Because last Sabbath there was two people that came on camp, actually three people, because the son came with his wife. But the pastor that came was 96 years old, hiking on his own power, not any dementia at all, mind as sharp as can be, from Montana. And he was there with his son, who's also a retired pastor in his 70s. And he came with his wife. And they just came because they're excited about Weimar living, and they had never been to Weimar Institute. And they came there to eat lunch and to stay there Friday night and come to the Weimar Church and experience that. And they said, you know, I'm sure Dr. Nedley is off. We've never had a chance to meet him. We'll probably never see him. And within minutes of them arriving at the cafeteria, I was there late in the cafeteria. They were one of the last ones eating, so I sat down with them, and they were just thrilled to be at Weimar Institute. And they told us that both of them actually send a donation to Weimar every month because of their belief in what we are doing with the comprehensive message. And so it's great for me to meet just the rank and file donors that are there. But despite this 96 years old, this guy was not depressed. He was enthusiastic, and he was still thinking of ways to reach humanity, and he was very excited about being able to be at a place where the Spirit of God leads there at Weimar Institute. And so, but he had the other things going, you know. His diet was the Weimar diet. So tryptophan, it improves premenstrual dysphoria from ovulation to the third day of menstruation. And so it can get rid of even the hormonal depression. Depression and seasonal affective disorder has also been shown to improve. Insomnia improves. Even obstructive sleep apnea. Now, what's the most common treatment for sleep apnea? CPAP mask. What's the most effective treatment for sleep apnea? It's actually weight loss if you're overweight. You lose some of that tissue. There's a lot more room for that air to move. But sometimes weight loss doesn't work because of the anatomy that's there. And tryptophan has been shown to improve all forms of sleep apnea. And so it's one of the tools that we utilize is getting enough tryptophan into the brain to help with sleep apnea. And it also helps with getting rid of addictions. We have many people that come to our program. Nicotine is a tough addiction to get rid of. It's actually been shown to be tougher to get rid of than even heroin. And you know, we have a lot of people that come on narcotics. By the way, we tell them to get off their narcotics before they come. That's one thing that we can actually do on our own. You don't go through deadly seizures from withdrawing from narcotics abruptly. In fact, our nurse that works for us right now, she was on 400 milligrams of OxyContin a day, $50,000 a month habit, and having to steal and do whatever she could to get money. Of course, she offended a lot of her loved ones as a result, but she was able to get rid of. She did it on her own. She went to her grandmother's house, who allowed her to withdraw from her own house, and she just got off of that. Terrible dysphoria, all sorts of problems, but it's not deadly. You don't die from narcotic withdrawal. And once you get through the process, then she needed to come to a program like ours to be able to fix some of the brain chemistry things that she was self-medicating with. But one of the ways in which she was helped was getting enough of this tryptophan and serotonin in her self. And she's one who, since she works there now as our nurse, she was an LPN before she got on all these drugs to begin with. And now she's working every day helping people with depression and anxiety. So let's take a look at the foods rich in tryptophan. Whole milk is one of those foods. When I was in medical school, I was told about tryptophan and whole milk, and you can see it's a pretty good source. But there are better sources: black-eyed peas, walnuts, almonds, sesame seeds, gluten. Just some words about gluten. Gluten is called wheat meat, and it actually is a great source of tryptophan. It's also a great source of glutamine, which helps us to make a number of different neurotransmitters that help us to stay calm under stress. This is why wheat has been shown to be a very healthy food for those in mental illness, except for the less than 4% of people who are sensitive to it. And it turns out only 1% are really, less than 1% are really sensitive to it to the point of celiac disease. And many of the rest of the 4%, it's not the wheat they're sensitive to, it's the pesticides that tend to go with the wheat. And so the organic wheat is often all they need to do instead of necessarily being gluten-free. And so we utilize, although we do have diets for those that are gluten sensitive and we have gluten-free, there's a way around that. If you're not gluten sensitive, there's not a reason to withdraw from wheat. And there's a lot of people thinking you just shouldn't have wheat if you're going to have good health. And that's not true. Pumpkin seeds also are even higher than gluten, and the highest source is another concentrated source of soy called tofu. Now, it's not only tryptophan in the diet, but we want to get tryptophan into the brain. And there's two ways of getting tryptophan into the brain. Two ways together. One is it's a carbohydrate-mediated mechanism, so we have to have the insulin there to get the tryptophan into the brain, and the insulin has to be, we have to be sensitive to it. So that's why exercise and those type of things are important. But the other aspect of it is we need to be getting tryptophan from sources that don't have the competitors that block tryptophan from getting into the brain. It turns out there's 6 different neutral amino acids that will block tryptophan from getting into the brain. Now, the brain is like a steel pipe. The blood vessel is called a blood-brain barrier, so it only lets small molecules through, and tryptophan is one of these large neutral amino acids, so it has to have a carrier. It doesn't automatically go into the brain. It has to have a carrier to get it across, and if that carrier is filled with another neutral amino acid, that's going to be a problem, and that's why high-protein foods are not the solution. These people that are on high-protein diets and taking these protein supplements, they're getting an abundance of these large neutral amino acids, which are actually blocking their ability to have tryptophan into the brain for them to be able to make serotonin. And this is why it's the lower protein foods that have less of that competition that are going to have the effect. So let's take a look at the ratio of the competitors. You know, you could see milk had quite a bit of tryptophan, but it has 60% of those blockers, the neutral amino acids. Salmon, 40%, 60% as well. By the way, which food do you think you would get more tryptophan into the brain, milk or salmon? I hear most people saying salmon. I think I heard a milk over here. It turns out it's milk. Why is that the case? Remember, there was something that's also needed to get tryptophan into the brain? Carbs. Which of those two foods are going to be higher in carbs? It's the milk that's going to have the carbs. It's a carbohydrate-mediated mechanism. And so a salmon, you know, has some omega-3 in it. It's high in protein, high in fat, but virtually no carbs. It's a carbohydrate-deficient food, and so it's not really going to be a source of us making more serotonin. Let's look at the next 3, beef, chicken, and brown rice. A little better ratio of those 3. Which one are you going to get more tryptophan into the brain? Brown rice, yes, you're getting it now. Black-eyed peas, a little bit higher. Soybeans, higher yet. Black walnuts, higher yet. Pumpkin seeds, higher yet. Tofu, higher yet. Almonds, higher yet. And the highest source, and sorry it's blocked at the bottom of the screen there, the highest source is actually sesame seeds. Yes, somebody could read the top of it there. And this is one of the advantages of hummus or tahini, because it's going to have that nice ratio. You're going to be able to make more serotonin from these foods, and it can have a significant effect. This study showed in stress-prone subjects, high-carb, low-protein food prevents the deterioration of mood and performance under uncontrollable laboratory stress conditions. Stress-prone subjects have a higher risk of brain serotonin deficiency. In such subjects, higher natural carbs increase personal control. And that's simply because you're able to make more serotonin that way. Carbohydrates prevent a functional shortage of central serotonin during acute stress due to their potentiating effect on brain tryptophan. And of course, this helps us to realize why a plant-based diet that's going to be lower in protein and higher in carbs is going to be a much healthier way for the brain to be able to make enough serotonin. There's another important amino acid called tyrosine, and tyrosine is incorporated into proteins of all life forms and is a precursor for the synthesis of thyroxine. In fact, a lot of people ask me, how can I make more thyroid naturally? Well, we make it out of tyrosine. And so that's one way, getting foods higher in tyrosine. Melanin and kephalins and two neurotransmitters. What are the neurotransmitters that come from tyrosine? Dopamine and norepinephrine. Now let's go into these chemicals a little bit. What does norepinephrine do? What is it going to help us with? Anybody? It's going to help us with energy. Yes, it's going to help us. Symptoms of fatigue, for instance, can be greatly alleviated as a result of getting enough tyrosine to make enough norepinephrine. It's also going to help us with memory, and it's going to help us with retention and focus. What is dopamine going to help us with? Dopamine is going to help us with motivation. And this is the chemical that's going to also help us to be able to have experience pleasure with just the simple pleasures in life. But it's also a powerful motivator. Remember, yesterday we talked about it as that seeking chemical that helps us to seek out and anticipate. Tyrosine is also an antioxidant, and it stimulates growth hormone production, which is another advantage. It may be of therapeutic benefit in improving depression, high blood pressure, stress, cognitive function, memory, Parkinson's disease, PKU, and also narcolepsy. Looking around the room here, we might have one or two of you that need more tyrosine. Narcolepsy is when you sit down and you don't want to go to sleep, but you just can't help it, and you're going to sleep. Even Parkinson's disease. We had one a patient that still sticks in my mind, in part because I keep getting thank you notes from her husband. But this was a woman who was turned down from coming to our program. We only have 20 spots per program. And so we have to select out the group that's going to have the highest likelihood of success in putting this forward. And in her case, there was a great inhibitor of success, and that is she had advanced Parkinson's and was wheelchair bound. And as you know, exercise is part of it, so all things being equal, we wanted to choose someone who could exercise versus someone who couldn't. And so our screener turned her down, and the husband was very insistent. The husband said, I think Dr. Nedley's going to have more compassion than you. Make sure you run her case by Dr. Nedley. And so the case was run by me, and I said, Leanne, you're right. I don't think we can take her with her advanced Parkinson's. And then she also mentioned, and of course she's a nurse in our program as well, but she says, we don't have 24/7 care. She has to be fed, she has to be dressed, she has to do all of these things. And so when he called back, said, no, Dr. Nedley said no. And plus, she mentioned about we don't have the 24/7 care. That's an ambulatory program. And he says, I will come with her. I will dress her. I will feed her. I will do everything for her. Please let her in this program. Well, about a week before the program began, I got a call from her famous Parkinson's specialist neurologist at Johns Hopkins University, and said, Dr. Nedley, will you please take my patient in your program? And I says, we turned her down because of her advanced Parkinson's, and tell me about that. And she says, yeah, it's very advanced. But I'm doing what I can for that, but a lot of her issues are stemming from her depression. And I think if her depression gets better, her Parkinson's will also get better some, but I know we're not going to cure it or anything like that, but please, if there's any way. So I called Leanne back and I said, I know our program's filled up, but why don't you move her to the top of the list in case someone cancels? And often someone does cancel, although, the last 2 programs ago, nobody canceled the last 2 weeks, and everyone at the top of the waiting list thought they were going to get in, and it didn't happen. But in this case, somebody did cancel the last day, and she comes out from Johns Hopkins, and I didn't have a chance to notify the rest of our staff, including the administrator, and so there she is with her wheelchair, with him wheeling her across campus. And the administrator of our program kind of blew a gasket, and how did we let this person into our program? And I got a knock on my door, and I said, well, she's not accepted for sure until I see her. And so when I saw her, I wanted him with her, and he said the same things. I will feed her, I will dress her, I will do all of these things. I wanted to make sure he wasn't going to change now that she was there in the program. And so what we did for her that first night, I says, well, you have a shortage of dopamine. You're not able to make dopamine. Parkinson's is a disease of toxicity. It actually, through toxins, gets rid of the dopamine-producing cells in the substantia nigra, portion of the brainstem there. And so I said, you don't have many dopamine-producing cells, but the ones that can produce, we'd like them to get at least enough of the substrate. And so I'm going to put you on some L-tyrosine supplements. And I had her take it that evening, and then I also had her take it the next morning on an empty stomach before breakfast. And then I wasn't there, our staff was there, but in the morning, she got up out of her wheelchair, and there's a hill from where the inn is to where the cafeteria is. And she got up out of her wheelchair and she began to walk to the cafeteria. It wasn't a big walk, but it was kind of a walk like this. And her husband about blew a gasket. No, honey, no, you're going to fall. Please, let me help you. And she says, get out of my way. and she's walking up to the cafeteria. And yes, the Parkinson's specialist was correct. We did not cure her Parkinson's, but through the aspects of what we were able to do with depression recovery, she did have a remarkable recovery from her depression. She had a sense of purpose again. Her sense of purpose had been totally taken away. She was actually a physician that had to retire prematurely because of premature Parkinson's disease. And so we get a letter about every month from the husband thanking us again for allowing her to go through the program. But if it can do that with Parkinson's, think of what it can do with people that actually do have dopamine-producing cells that can produce better dopamine levels. And so we can see some significant advantages for those that are short of those two neurochemicals. Tyrosine has been shown to significantly reduce headaches as well. Stress, fatigue, muscle aches, and sleepiness compared to controls. Improvements were noted in mood, mental states, happiness, mental clarity, hostility and tension, and cognitive tests. math tests, coding map compass, and pattern recognition in the tyrosine group. Feelings of vigor and improvements in blood pressure also occur. Now, there's a different set of foods that are high in tyrosine. You see mustard greens are a pretty good source. Lamb's quarters even higher yet. Now, lamb's quarters is not the small, or the hind leg of a small sheep. It is actually a green. It's a very tender green that's quite high in calcium. Tomatoes have more, tofu more. Edamame, those are the green soybeans loaded with tyrosine. Eggs, almonds, oats are in the top 5. Sunflower seeds, peanuts, and pumpkin seeds, as well as squash seeds, top the list. Tyrosine doesn't have as many competitors to get it across the blood-brain barrier, but it has 3 other competitors, and we like to choose foods from the higher list here. You can see sweet potatoes are on the higher list, flaxseed, chia seeds. Beef we probably shouldn't have it on the list because, again, it's still a carbohydrate-mediated mechanism to get tyrosine across the blood-brain barrier as well. And so we're not going to get much from beef. But tofu has a better ratio. Pumpkin seeds are up there in the top 5, soybeans in the top 4. Spirulina or seaweed is high. And the 2 highest sources are watermelon and mustard greens. Now, where can this come into action? Our program is also a caffeine-free program. Caffeine-free is there for a reason because caffeine is going to fuel anxiety. It also blocks adenosine receptors in the frontal lobe, and so you have less ability to manage your emotions. Studies show that when you have caffeine on board, you're much more likely to gossip than when you don't have caffeine on board. And so it's better for the relationships as well to not have caffeine on board. And of course, we can see some of the effects of frontal lobe even in sports. Because the most famous sport in America, what is that most famous sport? It's not baseball, it's football. Yeah, in the National Football League, it turns out there's only one player that requires an intact frontal lobe to be successful. Which player is that? It's the quarterback. Why does he need a frontal lobe? He's analyzing information and making a decision. And the studies show they make much better decisions when there's no caffeine on board. That's why Tom Brady consumes 0 caffeine. If he needs it for his frontal lobe, in regards to mental health conditions, it's far better to be caffeine-free. So we go caffeine-free, but this guy who came to our program was a trucker. And there would be times when he would find out from his boss at 6 o'clock that he had to deliver a part from Texas to Albuquerque. And he would have to drive all night for the oil field part that was needed. And he said, how am I going to be able to do this without caffeine? And he didn't think about it until about 6 or 7 days after he got off his caffeine. That was when the frontal lobe was starting to work. And then he started realizing, wait a minute, what am I going to do? And once you're caffeine-free, it takes about 14 days of being caffeine-free, you won't need the caffeine if you're eating tyrosine types of foods. And so for him, I gave him 2 choices. I said, take mustard greens with you or watermelon. What do you think he chose to take? He chose watermelon. I wouldn't have given him that choice if he had been a diabetic. I would have just given him mustard greens, but he wasn't a diabetic. And he says it works like a charm. When he has the watermelon, he actually feels better. His mind is alert, but he doesn't feel wired and not so good like he did under caffeine. And he's able to, with that watermelon, stay awake all night. But that's a caution for you. Once you're caffeine-free, watermelon is not the greatest evening food. It should be taken maybe at breakfast or earlier in the day, but it will tend to delay your circadian rhythms because you're going to have energy and you're going to want to go later. Don't chow down on high protein sources to boost either tyrosine or tryptophan. Emphasize carbohydrate-rich plant sources of nutrition. An additional problem is not enough folate. And this is a problem that underpins a good segment of our society. The U.S. government has targeted folate as being undersupplied in 20% of Americans, and that's the minimum amount. But it turns out we need more than the minimum amount for optimal brain mental health. We need 1,000 micrograms a day. The U.S. government says 400 micrograms is your minimum. But you can see if you're getting 1,000 micrograms from beef, you'd have to eat so much beef you would die that day trying to get enough folate. So we have to go to other sources: parsnips, pineapple juice, fresh orange juice, peanuts, mustard greens to come out pretty high here too. Spinach is an excellent source. Navy beans, very high, 1 cup 255. A cup of okra, 269. You grow okra here in Arizona? All right, great. Notice lentils, 1 cup of lentils, 831 micrograms. And the highest source, black-eyed peas. We have an organic black-eyed pea farmer right there in the Sacramento Valley. We get our black-eyed peas from. It's kind of a sweet legume. And just 1 cup a day will give you all that you need, that 1,000 micrograms a day when you're able to get the black-eyed peas. Another problem is atherosclerosis, causing heart disease or mini strokes, or even high cholesterol, which is one of the causes of atherosclerosis. Patients with major depression tend to have significantly higher cholesterol levels than healthy adults. Depressed patients with elevated cholesterol have a poorer prognosis for treatment response, and lowering cholesterol levels improves mood, depression, and improves impulsivity. By the way, this is one of the speaking of impulsivity, this is one of the downsides of those vacuum cleaner blockers. Those vacuum cleaner blockers, although they can improve mood, they worsen impulsivity. And they actually worsen impulsivity before they improve the mood. And that's why they have all these black box warnings. Do you know what the black box warnings say? You give this to a person with depression and they might commit suicide. And that makes it, how do you weigh that risk? You're wanting to help them. This is the toolbox, but this toolbox has this big risk factor of suicide. But suicide is very often an impulsive act. And so if their depression hasn't improved and now you've added impulsivity to it, this is why many people actually commit suicide within a week or two of getting on this medication before it's had a chance to respond. Another thing it does is cause an I don't care attitude, these medicines. And a lot of people like that because their emotions are so bad, it's almost like they're caring too much. So when their emotions are blunted, it's like they don't care, but then it causes them to be demotivated because they don't care. And so that's why we have to weigh benefits versus the risks. These are not just clean effects of getting benefit like there would be in utilizing nutrition. When we lower cholesterol, we actually improve the depression and mood, and we improve the impulsivity, and we're not going to lower the motivation. And this is why it's so crucially important to look for alternatives besides these medications. So let's take a look at foods high in cholesterol. First of all, fruits, grains, nuts, and vegetables. How much cholesterol? 0. Even skim milk has some cholesterol, 4 to 5 milligrams, 2% milk 18, whole milk 33 milligrams. Egg white is the exception to the animal product rule. No cholesterol in egg whites. Mayonnaise 8, ice cream 29, butter 31. But notice the egg yolk, 213 milligrams of cholesterol. It is loaded with cholesterol. A lot of people are confused about tuna. They think it's part of the plant kingdom and has no cholesterol. But tuna is part of the animal kingdom. It has a liver, and it does make cholesterol. And studies show if you feed a vegetarian fish, their cholesterol levels invariably go up. Clams 57, crabs 64. Chicken breast, if you're careful and scrape the fat and the skin off, which most don't, 73 milligrams. Pork, 76 milligrams per serving. Beef, 80 milligrams per serving. And if you don't scrape the fat and the skin off your chicken, it actually has more cholesterol than red meat. A lot of people are not aware of that. Oyster, a lot of people think, well, seafood is the way to go. And I had a lot of patients in Oklahoma. I don't hear this too much in California where I'm at, but a lot of patients in Oklahoma told me they were on a seafood diet. And I would say, what does that mean? And they say, I see food and I eat it. And I didn't tell them what was going through my mind after that, which was, I don't think you needed to tell me that. I could tell by looking. But nonetheless, they were proud of their seafood diets. But oyster, 84 milligrams. It's quite high, as is sardines, 120. Shrimp, just a 3-ounce serving, 165 milligrams. Kidney, 329. Liver, 410. The organ meats are loaded. Caviar, 500 milligrams. And if you see anyone feasting on beef brains, you have to wonder about their intentions. 1 3-ounce serving, 1,697 milligrams of cholesterol. Now, cholesterol will raise our blood cholesterol, but not all cholesterol is the same as far as the damage it does. And Dr. Bruce Taylor found this out. This is why it's nice to have medical students and students associated with our programs and in our schools. But this was a group of students from New York who needed to do a study. In New York Medical School, you had to do a study. It didn't have to be publishable, but at least you had to do a study so that the budding doctor would know what these studies are like. And so, but you had to search the medical literature and do a study that others hadn't done to try to fill a role. And so they were looking for something that no one had done, and they said, we have found a study, we're going to do it, and we're going to feed rabbits and monkeys pure cholesterol and see what happens to them. And so they came to the cholesterol researcher, who was Dr. Taylor, and they told him about his study, their study. And he says, okay, why are you talking to me? And they said, well, we need some cholesterol to feed them, and you're the cholesterol researcher. We thought you might have some. And he says, yeah, I've got pure cholesterol. It's been there for a while, but it's nothing but pure cholesterol. It's over there in that bucket. You can use that. So they used the bucket, and they fed rabbits and monkeys pure cholesterol for weeks. And within just a few weeks, these rabbits and monkeys started to have strokes, heart attacks. It was pretty dramatic. And the students wrote up their data, they showed their data, and they were done with their study enough to be able to graduate. But Dr. Taylor was thinking, just a few weeks for these healthy rabbits and monkeys. And he started thinking about the cholesterol they had given them, and he realized it was pure cholesterol, but the lid had been off of it. It had become discolored, become oxidized. And he thought, I wonder what would happen if we fed pure cholesterol that's never been exposed to the air to rabbits and monkeys. So the students are gone at this point, but now he's interested enough, so he designs the study and conducts it. And if it's pure cholesterol, it's a clear, waxy substance if it hasn't been oxidized. And so this was fed to rabbits and monkeys, and none of them developed any damage to their arteries. And then he realized, well, people don't eat just pure cholesterol, they're eating foods. And so he was interested to see the foods that would be having the most damaging cholesterol. And so he would feed this food only for 24 hours to a monkey. And then after that, he would go into their aorta and see the damage that had been done. It doesn't take long for the necrosis and the damage to be done from oxidized cholesterol. And he was able to find the most damaging cholesterol this way, the ones that were most oxidized. The top was custards as far as the most damage. What are custards? Yeah, the most common custard is good old-fashioned ice cream, but it's where you take milk, eggs, and what else? Sugar, and you mix it up in an environment and it heavily oxidizes it. This is why one of our board members who is from Montana, he has come up with a whole food company after reading our book Proof Positive, and he has produced 32 flavors of ice cream, one more than Baskin-Robbins, coming up with ice cream that has 0 cholesterol in it. And it actually comes out and taste tests to be tastier than regular ice cream. Anyone want to guess what the base of it is? All 32 flavors, the base of it is oats. Oats, when you grind them up, are very creamy. It produces this nice creamy flavor and texture. And he's able to, in fact, his biggest challenge was naming it, because you can't name it ice cream if it doesn't have cow's milk. Even in goat's milk, you can't name it ice cream. And so he finally thought of the name for it. It's called We Can't Say It's Ice Cream. And And you can find this in Whole Foods and other places. By the way, he's come up with cheeses as well. He's come up with a whole product line. In fact, speaking of butter, he made a butter that you cannot tell the difference, and he was able to call it butter. Do you know why he was able to call it butter? Guess what he made it out of? Butter beans. And butter beans are this very smooth texture, and it actually is really selling a lot. In fact, I think the military is about ready to, in fact, I don't know if they'll be able to get by with this, but they were going to buy it for all of the U.S. military instead of regular butter, and not even tell any of the soldiers about it because of it's so similar to butter. It melts like butter. It does all the things like butter does. It's pretty amazing. But second, pancake mix. What is pancake mix made out of primarily? Yeah, you're taking flour and eggs and you're powdering it up. So you're heavily oxidizing it. Third most damaging, Parmesan cheese. And of course, this is powdered cheese, heavily oxidized, and that's not a misprint. It was tied with lard with being the third most damaging cholesterol. But these studies by Bruce Taylor also explain some other things prior to this that we didn't understand. Dr. Jeremiah Stamler from Chicago had shown that no matter what your blood cholesterol is, your dietary cholesterol is an independent risk factor for the development of heart disease and stroke. So some people pride themselves, hey, I've got good genetics, I've got a cholesterol of 150. And yeah, that's better than having a cholesterol of 200 or 250. But if you're eating high cholesterol foods, you'll actually increase your risk significantly over someone who's got a cholesterol of 150 and not eating high cholesterol foods. And that's because of this oxidization thing. But it also helped explain some infant studies. This was the Bogalusa study where they took young infants. Bogalusa, anyone know what state that's in? Louisiana. Is Louisiana known for their healthy food? No, it's Cajun food. You know, it's this French, very unhealthy, even more unhealthy than French food per se. And some women, the way they eat in Louisiana, they're eating at McDonald's and all these places. The amount of cholesterol in their human breast milk is higher than it is in cow's milk. And so they were interested in the Bogalusa heart study because some infants begin to get damage to their arteries in infancy. Fatty streaks, you'll see them in their aorta. And so in the Bogalusa heart study, they looked at the infant's vessels. And of course, it's kind of sad how they do this. If they die from auto accidents or they die from sudden infant death or other things, there are autopsies that are done. And then in the autopsies, they could see these fatty streaks, and they would compare it with the dietary inventory on what they were eating. And they found out, which group do you think had the fatty streaks? Those consuming cow's milk or human breast milk? You might think human breast milk because it's higher than in cow's milk in Louisiana, but it wasn't true. Those consuming cow's milk had the fatty streaks. Those consuming human breast milk, their blood vessels were clean. Why is that the case? The way most infants consume human breast milk is directly from the nipple. It's not exposed to the air, and it's not oxidized, and it's not damaging. So for the best way for you to drink your cow's milk, go down to the barn and get it straight. Interestingly, years ago, Ellen White said this, especially harmful are the what? The custards and puddings in which milk, eggs, and what else? Sugar are the chief ingredients. Free use of milk and sugar together should be avoided. We also know antioxidants are very important. Those with anxiety and depression have lower blood antioxidants in comparison to healthy controls, and just putting them on antioxidant vitamins for 6 weeks significantly reduces their anxiety and depression scores. But we can do better than these antioxidant pills. The power of whole plant foods actually exceeds that of their component parts. 1 cup of kale has 50 milligrams of vitamin C, for instance, and 13 units of vitamin E. But the antioxidant potential of 1 cup of kale is equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. That's very potent, and that's why eating the whole plant food is far superior than taking these in the form of vitamins. The Human Nutrition Laboratory in Baltimore, Maryland recently took a look at the top 10 antioxidant vegetables. Number 10 on their list, eggplant, a very good antioxidant vegetable. Number 9, corn. Number 8, onions are also loaded with antioxidants. Number 7, red bell pepper. Number 6, beets. Number 5, broccoli. Anyone want to guess what's in the top 4? Brussels sprouts are up there in the top. Spinach is number 3. Number 2 is kale. And the number 1 antioxidant vegetable, you'd think mustard greens come out on top in a lot of areas, but it isn't mustard greens. You'll kick yourself for not getting this one. The number 1 antioxidant vegetable, garlic. That's the advantage of being married to a Romanian, is every entree starts out with 4 cloves of garlic. And then the top fruits, number 10, grapefruit. Number 9, kiwi. Number 8, cherries. Number 7, red grapes. Number 6, oranges. Number 5, a lot of times we think this is, too beneath us, but this is a humble fruit, but it's loaded with antioxidants. Plums. Number 4, raspberries. Number 3, strawberries. Number 2, blackberries. Anyone want to guess what's number 1? Blueberries, the number 1 antioxidant fruit. I could talk a lot about blueberries. There's been a lot of studies done on this. By the way, a cup of blueberries a week delays the development of dementia considerably by years. And so blueberries are one of those things. We'll get into that tomorrow, I think, when we talk about dementia. Vegetarian diets also associate with healthy mood states. One of the reasons for this is vegetarian diets don't only have oxidized cholesterol if they're plant-based, but they also don't have arachidonic acid. Arachidonic acid is a pro-inflammatory mediator. It's present in fish, in meat, and it's also present in eggs. It's not present in dairy or in plant foods. But arachidonic acid is going to fuel inflammation, and depression and anxiety is often an inflammatory disease of the brain. And so we'll have a dramatic effect within 2 weeks just by switching to plant-based. The scores will go down by half in depression and anxiety. Negligible arachidonic acid intake explains the favorable mood file we observed with vegetarian diets. We're told the sin of intemperate eating too frequently, too much, and of rich, unwholesome food destroys the healthy action of the digestive organs, affects the brain, and perverts the judgment, preventing rational, calm, healthy thinking and acting. What part of the brain is being affected here? That's the frontal lobe. And we're told this is a fruitful source of what? Church trials. So the argument in the church board meeting may not be due to what you think it's due to. It may be to what the people ate before they got to the board meeting. And no matter how much you explain something on the area of principle, the frontal lobes are not there to be able to understand it. Few understand how much their habits of diet have to do with their health, their characters, their usefulness in this world, and we're even told even their eternal destiny. And this is why God is very interested. In the New Testament, he said, whatsoever ye, what? Eat, or whatsoever you drink, do all to the glory of God. I'll skip through. We're about ready to be through. I was going to talk to you about some other things that have powerful effects. I should mention this as well. This is B12 aspects in getting enough either methyl or hydroxycobalamin. It's not just folate, produces enough SAMe for us to make more dopamine, 5-hydroxytryptophan, and norepinephrine. So that's why the B vitamins are important, particularly B12, which is something we almost recommend for everybody. Omega-3 also is important as well. And it can help even with bipolar disorder as well. Fish is not the healthiest way to get our omega-3 anymore because of biomagnification. It's the most toxic food in our food supply, including mercury, which causes a lot of problems to the brain. And that's why we want omega-3 without cholesterol, mercury, and other toxins. And these would be some of the foods like flaxseed and chia and walnuts that would be good to get. And then finally, to turn on neuroplasticity cells, ketosis is helpful. And this is where we get into time-restricted feeding and not eating in the evening. BDNF levels go up. It's almost like an antidepressant if you fast for over 12 hours, even better if you fast 17 hours a day. So that limits you to a good balanced breakfast and a good healthy lunch, and then we can make some positive changes. But I'll end with 2 slides here. This is a review article written by a very prestigious journal in Europe, Lancet Psychiatry. Now is the time for the recognition of the importance of nutrition and nutrient supplementation in psychiatry. Nutritional medicine should now be considered as a what? Mainstream element of psychiatric practice. So if your mental health professional is not talking to you about nutrition, they are not mainstream. They are behind the times. And I will end with the French philosopher Denis Diderot. He said, doctors are always working to preserve our health and cooks to destroy it, but the latter are often the more successful. It doesn't have to be that way if we retrain the cooks. If the cooks are retrained to cook healthfully and tastefully, there's no reason to go back to the other way of eating. And I would encourage us all to improve our diets, because by doing that, we are optimizing our brains. Let's bow our heads as we close. Father in heaven, we thank you that you have given us so many foods in this earth to enjoy that can also help our brains. And we pray, Lord, that we might choose healthfully, consistently in our lives. If we have some addictive relationships to ice cream or some of the things we've talked about that are not so healthy, we pray that you would help us with that as we choose to put our all on the altar of sacrifice for you. And we thank you that you came to give us life and to give it more abundantly. In Jesus' name we pray. Amen.